nerves are seen on this giant head. This is the same size as David's head. And as we start here, this is cranial nerve 1, the olfactory. Sits on the cribriform plates on either side of the crista galli and the ethmoid. The bipolar neurons from nasal mucosa bring in the information into the bulb, carry it through the tract, and back into the medial temporal lobe. Cranial nerve 2 comes from the eye. David was holding the eye and because it's the same size as his. And if we look here and look at this side of the model, the eye is going to it's going to come in right. Where's there it is, right there. Isn't it?
No, it's over here.
Where is it? Oh, I know that part, but I mean this part. Anyway, this is the lacrimal gland. The muscles of the eye are all innervated here by various muscles, by various nerves. The optic nerve, straight out of the back of the eye, is seen right there in white. Okay, that optic nerve is the product or the coming together of all the ganglion layer axons within the retina, carry sensory information through bipolar neurons into this pathway that goes through the optic canal, and it used to carry those impulses, and now this is through the optic canal of the sphenoid bone. That's seen here a little bit better. There's the sphenoid sinus, paranasal sinus. There's the optic canal. It's purely sensory, and it's going to the lateral geniculate body through the superior colliculi and destined for the occipital lobe and the visual cortex. The third cranial nerve, oculomotor, is seen here. Right, seen right there. Oculomotor is going through the superior orbital fissure, and it's innervating various structures. It's a mixed nerve. Its parasympathetic fibers will be going to the ciliary bodies that allow for the constriction of the pupil, and it's going to be that's the parasympathetic fibers. The motor fibers are going to the to 4 of the muscles of the eye: the inferior oblique, the medial rectus, the superior rectus, and the inferior rectus. Okay, those have motor fibers through this nerve, the oculomotor, to those muscles, and proprioceptive afferents to them as well, or from them as well. Number 4, cranial nerve is seen right here on top of the trigeminal. It's coming from the back side of the brainstem, just below the inferior colliculus. It is both motor and sensory, and it will be innervating the superior oblique muscle with proprioceptive afferents to the same muscle, and that is seen right here, and it's innervating it right there. Okay, so after this we have cranial nerve 5, the trigeminal. Trigeminal has 3 branches that are seen in this pattern. The 3 branches, as we can see, if we run that pattern on the face, we can see that the first branch goes also through the superior orbital fissure. It does the muscles that we see, let's see, we're doing 5. It does various structures on the face. It's the ophthalmic division, and it does the upper eyelid, the upper gum, the lip, and the, not the lip. It does the upper eyelid, the surface of the eye, the tear gland, the lacrimal gland that you see right here, superior and lateral on the eye, and various other structures. Okay, the second division right here, the maxillary, goes through the foramen rotundum, and as it moves through the foramen rotundum, it terminates into the top teeth. In the maxilla, it also does the hard palate and the roof of the mouth. It does the upper lip, the upper gum, and it does the facial area and skin on the area along its pathway. The bottom branch, the mandibular division of the trigeminal, goes straight down through the foramen ovale. It enters into the mandibular foramen and then moves forward into the alveolar margin at the base of all of the teeth. It is both motor and sensory. It's motor to the muscles of mastication, the temporalis, the masseter, the buccinator, and the zygomaticus, and it has proprioceptive afferents to each of those muscles. In addition, it does the lower lip, the lower gum, the teeth, and the skin, and the side of the head, scalp. All right, number 6 is the abducens. Abducens is going to be right here, moving, let's see, right here. It's going to be moving on top and then passing below and through and out the same pathway as the trigeminal. Abducens will be moving through the superior orbital fissure and innervating the lateral rectus muscle with proprioceptive afferents to the same muscle. Number 7, the facial will exit. okay, or exit and enter through the internal acoustic meatus of the temporal bone, and it travels with the vestibulocochlear from the inner ear structures. This is a mixed nerve. It does the submandibular gland, the sublingual gland, the two salivary glands. It does not do the parotid. It does parasympathetic fibers to those glands. It also does the muscles of facial expression and skin on the face that hasn't been done by previously mentioned nerves. Number 8, vestibulocochlear, is right here. Comes from the inner ear structures. Its vestibular portion does static equilibrium in head position. It also does within the semicircular canals and the balance that you have, the dynamic equilibrium and rotational balance. It's purely sensory. It goes through the internal acoustic meatus from the inner ear and enters into the temporal lobe after relaying through the inferior colliculus on its way there. All right, the cranial nerve 9 is right below. Actually, 9, 10, and 11 are all going through the jugular foramen. Number 9 is the glossopharyngeal. It does the large parotid gland on the side of the face. There's sublingual and submandibular. Parotid would be right here, as you see on the torso models. And that gland is actually the gland that has a duct that pierces the buccinator muscle and then releases into the mouth. It's going to be parasympathetic fibers that innervate that gland. It'll also do, as the name implies, the pharynx or windpipe, and the glosso is referring to the tongue. It does the top part of the tongue. Hypoglossal is below the tongue. So that's 9. It's mixed. Number 10 is the vagus nerve. It's the one that will be descending right here. It actually passes through that jugular foramen, and then it descends all the way down, and this is the carotid sheath, the jugular vein, carotid artery, and the vagus nerve that innervates all your internal organs. This carotid sheath is the pathway of the nerve on its way down to parasympathetic collateral ganglion that are adjacent to the spinal cord into the T1 to L2 lateral horn of the gray matter, or into the areas that are innervated by sympathetics from T1 to L2. This is cranial outflow, and therefore its parasympathetic return to normal after sympathetic fight or flight kicks in. That's the vagus, number 10. There's a lot of other things I can say about that, but essentially it's going through the opening that we just saw, the jugular foramen, and then descending all the way down into the abdominal area. Number 11, the spinal accessory comes from out of the sides of the spinal cord. It's a recurrent branch, which means it comes from below, out of the sides. It comes up through the foramen magnum and then exits and goes to the trapezius with twigs from C3 and C4 to innervate that muscle with proprioceptive afferents in the opposite direction. Number 12, hypoglossal, is going to surface from below but enters through the hypoglossal canal that pierces laterally, from lateral to medial, the occipital condyles that sit down on the atlas, on the vertebral column. It comes out, and as it exits that area, it's going to innervate the trapezius, the sternocleidomastoid, and the muscles of the shoulder, the levator scapula as well. But trapezius is the main innervation with twigs from C3 and C4. If it's motor to that muscle, it's also got proprioceptive afferents. Have a good day.